We have some excerpts from this video conference of physicians across the globe, uh, which is referred to as Global Indian Physicians COVID-19 Collaborative. The speakers included Dr. Pratap C. Reddy, founder chairman of Apollo Hospitals Group India, Dr. Vinod Pal, member of Niti Aayog, Dr. Bobby, Board of Trustee AMA USA, Dr. Kamlesh, Professor Primary Care Diabetes and Vascular Medicine UK.
A very warm welcome to all of you. As we launch the Global Indian Physician COVID-19 Collaborative, let me on behalf of everyone invite Dr. Pratap C. Reddy. Dr. Pratap C. Reddy is the founder, chairman of Apollo Hospitals Group. He's the founder, president of the Global Association of Physicians of Indian origin, uh, widely recognized as the architect of private healthcare in India, has made immense contribution to the way healthcare is practiced in India today. He's a recipient of many awards, the Padam Bhushan, the Padam Vibhushan, to name a few.
We are now witnessing World War III, a war that has engulfed more than 200 countries and territories in just 100 days, infecting more than 1.6 million people and taking away the lives of more than 900,000 lives. I'm now saying that the world as we see it, we know it, will never be the same. I'm 65 years as a doctor now, that the world as we know it will never be the same. In my 65 years as a doctor, I've never seen what we are seeing today. SARS-CoV-2, a 120 NM virus, has brought the world to a virtual standstill. It has made us pause, stop, and think. It has made us realize that the world we live in today has no borders. It has brought such a great distress to the world. It has made us aware that we as a human race can break the barriers that we have erected, and as a united force can take the challenge to stop this.
She is a psychiatrist by training, and she is the 174th president of the American Medical Association. She was appointed in June 2019. She has diverse experience as a private practicing physician, a public health administrator, and a patient advocate.
As been said, the coronavirus pandemic presents a challenge that I hate to use the word unprecedented. Sometimes it's overused, but we have not seen in a couple of generations. And we know, unfortunately, in the U.S., everywhere cases are climbing. Certain places cases have decreased, but then are on the increase. So there's so much we don't know about this virus. But in the U.S., our cases are climbing. Deaths are mounting, again, in physicians, nurses, all of the healthcare workers. And actually, not just the healthcare workers, those who are driving buses and cleaning our facilities are on the front lines every day, working long hours under intense pressure and sometimes, unfortunately, dangerous conditions. And we know, of course, that is happening all over the world. The toll is staggering. We all know that we are not going to be able to flip an on switch. It's going to take some time. And again, that's working together globally before we get back to what I say is a new normal. We will not get back to the normal pre-COVID-19, but a new normal.
Thank you so much, Dr. Harris. And I could just see that Professor Vinod Paul has joined us. Thank you so much, Vinodji, for joining. And you've led the charge for 1.35 billion people. We're really proud of the way you've worked 24/7 over the last few months. And in fact, you started very early in January, long before India had its first case. So over to you, Professor Paul.
I would also like to emphasize that our journey is not only to address the problem in this manner. We are also looking at a very major COVID-19 R&D mission, research and development mission. We have a strength in this area. We have a very vibrant industry, biotechnology and a pharma, and also to an extent biomed devices industry. We have a plethora of laboratories in the space of Indian Council of Medical Research, the Department of Biotechnology, Department of Science and Technology, Council for Scientific and Industrial Research. There's a plethora of national laboratories, and we have mounted a very concerted effort. And I'm pleased to tell you that at least 3 Indian diagnostic kits have been placed in the market. I'm happy to tell you that there are 4 vaccine candidates in at least 4 of our laboratories. I'm happy to tell you that our industry is already working with collaborators outside India to take forward 4 potential vaccines.
Moving on, we now go on to Dr. Bobby Mukamala. Bobby is a board certified ENT surgeon, a head and neck surgeon, was elected to the American Medical Association Board of Trustees in 2007. He's been very active with AMA since his residency and now serves as the secretary of AMA. Over to you, Bobby, and Bobby's going to share his perspective.
So here in Michigan, my home state, for example, the latest statistics are that we have 22,000 COVID-19 positive cases and 1,200 deaths as of yesterday, just in our one state here. The vast majority of those cases and deaths are in the Detroit area, which is our metropolitan center, and extending out from that metropolitan center into where I live, which is Flint, which is about 60 miles north of Detroit. So these are urban areas with large underserved populations. And I think as we see data from around the country, we will see a disproportionate effect of this infection in these underserved populations.
We now move on and bring Dr. Sudhir Parekh in. Sudhir Bhai is a renowned specialist in allergy and immunology, practices in New York. He's been honored with the Padam Shri, the Knight of St. John's, Knight of Malta, and the Ellis Island Medal of Honor. He's currently the Secretary General. Over to you, Sudhir Bhai.
Good morning, good evening to everyone. I'm coming from the epicenter of this COVID-19 in USA. And a lot of our colleagues and friends, and particularly Indian Americans, physicians are in the front line. They are working hard and against all odds. Luckily, now in New York and New Jersey, the curve is kind of flattening. Number of ICU admissions are less, number of discharge are more. So that's some good silver lining in this epicenter of New York, New Jersey.
I'm going to invite our dear friend, Dr. Suresh Reddy. Suresh is the dynamic current president of the American Association of Physicians of Indian Origin, very well known as API. He's the 36th president. Suresh is a neurointerventional radiologist, and he's been instrumental in putting this collaborative together.
Today, I'll be talking about the next 2 weeks. I think the next 2 weeks, the game changer. I honestly believe and pray that the convalescent plasma is going to be the game changer. So we already established a committee, a team from API called API COVID Plasma Donor Committee, which is working very hard, extremely hard, along with the Red Cross. And our role at this point is collecting the database, the donors and the recipients, and working with Red Cross and complementing and facilitating their actions. We also requested the President of United States and sent letters to all the governors of all states to establish more and more centers in all the major cities in United States and make all the medical centers in United States accredited to administer this plasma. And there are several protocols going on. I think the most popular one at this point is the Mayo Clinic.
Challenging times requires collective contribution to the cause and standing to face the challenge in support of the happenings in India. A special significant contribution from House of Spices to the tune of $250,000 for COVID-19 India relief has been made, telling ITV Goal all about it in conversation with Adi Lamba, Vice President Amrpali Soni.
It's a huge fund that you have started, House of Spices has started, called Lakshmi Cares. Beautiful name. And I think the idea behind it is even more beautiful. But it is to match this great donation that was made by your team for South Asia to fight coronavirus. A little insight into what is happening on that, and what sort of inspired to do this GoFundMe to sort of bring in the community as well.
So House of Spices has donated to South Asia, and what we're looking to do, we've donated already to different funds across South Asia at a national level. So, India, we're looking, if Bangladesh comes up with one, we would also do there, Nepal through care.org. So we're looking to mobilize the community and the House of Spices community to match our donations so that we can make a larger impact.
Right, and bring me a little bit more insight into it. So currently, House of Spices has donated $250,000 to India for its relief efforts for COVID-19. There's a lot of marginalized community that really needs support there, and the hospitals. And simultaneously, now there is a GoFundMe that is to, empower it even more, if I'm getting the point right.
Yeah, that's correct. So what happened is right before the COVID-19 pandemic started, we had a loss in our family. The founder of House of Spices passed away. And when this happened, we really realized that we saw how developed countries like the United States of America and Europe were struggling. And we thought, this company was built by the relationships that our father had. And, a country like India, while it has hospitals and it has doctors and nurses, it doesn't necessarily have the resources across the land to help every single member that might need help for any reason. So what we're trying to do is donating at a national level. The government the governments managing those funds will do what they can, and they will put the money towards what they feel is the most necessary. But we're looking to match that donation and figure out where else we can donate, and mostly hospitals on the ground. So use mechanisms that we have to get closer to the people that need it.
Right, and in terms of these donations, Amrapali, when we're discussing about such a big, fundraising being sent to India to help with these, efforts, as well as another fundraiser being done, what exactly is being donated, and is PPE a part of that?
So what we're donating now is money, and that's the best way to help a country like India and countries across South Asia. But what we're doing here in the United States is we're working with someone running for Congress, Suraj Patel of District 12, and we're going to partner, Lakshmi Cares is going to partner with him to donate to hospitals around New York. So donate, like Elmhurst Hospital was the largest hit in the Queens community. So we will be donating products that we that we serve to the consumers, which is Parlay biscuits, Mazza juices, Foodie Tetra Packs. So we're going to do our best to do that as well on this side.
Yes, and definitely I want to discuss a lot more on the impact on the communities here in the US, but just wrapping up a little bit more on India. We are hearing about a rise in numbers of cases, and there's a lot of community that needs help. And there's a lot of support that's needed. So, I know your GoFundMe is for that, Lakshmi Cares is for that. Could you reflect on to the importance of that, since the situation is getting, worse as we speak?
What we want to do is figure out how to also help people that, don't necessarily understand what that national fund might do. So sometimes just a dollar donated to a hospital can go further than a dollar donated to a fund at a national level. So that's why we're looking for people and to mobilize the Indian South Asian community to match our donation, or every dollar counts here, and we want to take that and put it back into where we all came from.
So how can they all support you?
So you can search for Lakshmi Cares on GoFundMe, and any dollar counts here, as little as 50 cents to as much as $10,000. But every dollar that anyone can donate and put towards this, we would appreciate it tremendously.
Your dad and the founder, Mr. G.L. Soni, did some incredible works for the community. And House of Spices, for its 45 years, has truly served the South Asian community. You're one of the biggest distributors of South Asian food products in this country. Talk to me about how important it has been for you to serve the communities, South Asian Americans here and other minority communities during this time crisis. And I know your dad's impact is really big on you and your brother. So how important is this community service when you're looking at what he wanted as a vision?
So what we're doing today is tremendously important for where the company started. So our father started the business, just really thought, my mom said, I can't cook you dal bhat roti shak because I can't find the food. So he said, all right, I'm going to open up a store. That turned into the business we have today. And while we've served the community for over 45 years, in times of crisis, like right now, that is when it is most important. So House of Spices remains open. Our doors are open for delivery. So if you are a store owner or you are looking for food right now, we understand what that might feel like. If you don't know if your local store is open, you don't know the timings, and if you're a store owner, you don't know who's open to deliver merchandise. So for us right now, we want to focus on how to serve the community that has served us for so long, and let everyone know that we are open, that we have product, and that if you need help finding a local store, you can email us at customerservice@hosindia.com, and we would love to help you figure out or answer any questions in terms of stores or where to find food right now.
And Amrapali, as we're discussing, you have gone, kind of national with e-commerce, where it's not just wholesale distribution anymore. You can go into people's houses. Could you reflect upon those opportunities for consumers such as myself, who may want to actually have some dal and masalas that I'm running out of?
Yeah, we realize sometimes it's scary to go to a store at this time. So we've mobilized our e-commerce partners, and you can find Luxury Brand on Amazon.com. It's a safe way to buy food if you feel more comfortable than going to a grocery store. So you can find us on Amazon.com at a luxury store.
We appreciate your continued support for ITV Gold. Stay with us. We'll be right back after these short messages. It is always important to hear from experts what is it that we are facing in the form of COVID-19. Health experts Dr. Sudeep Chawla and Dr. Joravar Singh tells us about preventive measures.
Yeah, Aditi, you're right there. The numbers are rising, as we speak. And the best way to do that is how everybody's saying is to, isolate yourself and stay distant, socially distance yourself from people. And the best way is to wash your hands and stay clean. And, the worst thing is that we don't know who has this virus or not. Some people can stay asymptomatic or not have any symptoms.
Right.
So the best thing to do is to just isolate yourself, stay home, keep your hands clean, and avoid, large public gatherings.
Yes. Dr. Chawla?
I completely agree with what he's saying. I think what a lot of people are misinformed about is how long that this virus can stay alive. We really need to wipe everything down. We don't realize that this can spread even on door handles. Any common thing, even going through the grocery store. I read an article the other day that even things on like a box of cereal, that can hold the virus for so many days. So we have to be very cautious about those things as well. And social distancing is so important. There's a reason why they say 6 feet apart is because, a lot of this can be transmitted airborne. And if you look at something common like a cough or a sneeze, that can go as far as 6 feet. So that's kind of where the 6 foot number, came about. So we really do need to keep distance from each other, at least 6 feet.
Let me just try to understand this virus a little bit more. Why is it there are so many uncertainties in terms of the fact that, social distancing is such a prominent aspect of it. Literally, the only way to save ourselves, to protect ourselves right now, as we're looking at, is social distancing, which is to literally put everyone in their own places. Could you both reflect upon what is happening on the medicine side, on the vaccination side, the treatments, and why is it that we can only and only right now rely on social distancing? Because some people aren't even following it.
Right, from the medical perspective, from the hospital perspective, we're seeing patients come in a lot through our emergency departments with complaints such as fevers, chills, cough, shortness of breath. Those are the common symptoms of this virus. And to answer your question as to why people have to socially distance is because of what Dr. Chawla had mentioned, is this virus is spread through droplets, through air, as we speak, as we cough, as we sneeze. And when we do that, we usually sneeze or cough into our hands, and our hands touch other surfaces. The next person can go and touch that surface, and the first thing that they touch is usually their face or their mouth, without washing their hands, and that's how this virus is spread. So that's the importance of keeping the social distancing.
What are some of your uncertainties, Dr. Chawla, in terms of patient care right now?
I think a lot of the uncertainties out there is that patients are misinformed. I don't think they realize the severity of this virus. Most of us growing up were very familiar with the common flu. And, we really need to understand the differences between the common flu and COVID-19. There's two actually main factors. The first one we have to understand is that when you get the flu, you feel the symptoms within 1 to 2 days, right. The common flu. When you have COVID-19, it could take up to 14 days before you start to see symptoms. So that's why it's so important to keep distance. People feel that, hey, because I'm asymptomatic, I'm not feeling anything, I don't have the fever, I don't feel sick, that I can just go out and it's not going to spread to anybody else. So I think there's a lot of misinformation. And as much as the media is really hitting hard on that, it just seems like people don't want to listen. And so that's very important as well. The second factor is we have to look at is how contagious is this? And that's something that the CDC has spoke about. If you look at the common cold, you can spread that from one person to another. If you look at something like COVID-19, one person can spread it to 2 or 3 people. So exponentially, it could be spread a lot further. So I think it's really hitting hard that, humanity's just not listening right now, that, hey, you guys really need to bunker down. This is the only way that this virus is going to go away.
Snigdha Sur is a talented young Indian American journalist, writer, and multi-talented. Snigdha Sur has her own website, The Juggernaut. What she has to say about COVID-19, politics, and real journalism, Aditi talked to her. Here are some highlights.
What's been really interesting during this time is if you look at website data or traffic data, a lot of media companies are actually experiencing spikes in unique visitors, as well as increases in engagement time, as in people are staying at home, they're reading more, they're watching more, and you can see these phenomena through, the virality of Tiger King on Netflix, or the fact that the New York Times has nearly almost doubled its monthly traffic in the last 2 months, and even seeing, people like you still continuing to report during this time, because people are still craving knowledge about not just COVID, but you kind of see a bifurcation. You see there's a bunch of consumption on COVID news, but then there's also a bunch of escapism, which explains Tiger King. People don't want to be reading about COVID 24/7 all the time for many people. And so they're seeking those kind of 2 types of entertainment, which is informative news, or let me just kind of escape it and enjoy cooking or doing something else. You're also seeing the rise of Instagram Live because of that. In terms of how publishers prepare for that, I think their challenge is going to be, how do we convert this increased engagement and this increased traffic into revenue? Because a lot of media publishers who rely on advertisers are realizing that a lot of advertisers are pulling back extra spending. They're also realizing, because they're providing so much COVID content for free, so are we,
Right.
that stuff isn't translating to revenue. So that's going to be their challenge. In terms of what we're doing on the ground, the way we operate is we work with over 100 freelance journalists around the world.
Right.
And the benefit of, of the way journalists can operate as you are doing right now is that we have obviously advised all our journalists, please try not to do field reporting, in the sense that, like, you don't need to go meet people in person right now. So all of our journalists have been doing phone calls and getting as much information as possible by calling as many people and, being safe. So we've still been able to operate. In terms of the content we're covering, we were some of the first to cover a lot of the potential impact of COVID on South Asia. So when everybody was focused on China and America and Italy, as early February, before people realized it was a global pandemic, we reported on, here's what scientists are expecting will happen in South Asia. And unsurprisingly, a lot of scientists were saying, well, India isn't a global travel hub, so India won't be impacted, which is, when you really think about it, is kind of ridiculous. What ended up happening with India is that the first 3 cases were in Karnataka from students who had studied at Wuhan. That's fine. So a lot of it came from Wuhan. But then the second spike came from Italian tourists who entered via Delhi and then went to Rajasthan. Right. So what people have forgotten is that actually India has become a really hot tourist destination. Delhi has risen in the ranks to become one of the 11th most popular cities for people to travel into. So when you look at that new reality, you realize that Western media is still catching up to the ground reality of India's growth and India's popularity and just general kind of travel in South Asia.
Bernie Sanders has dropped out of the race, basically leaving former Vice President Joe Biden an open field for the Democratic nomination. Your take on what happened with the Sanders campaign, and as a publishing house, a media house, what do you have to say about how they rallied together for the last so many months?
Yeah, sure. So we were one of the early ones to cover Bernie Sanders and his popularity among South Asian Americans. So his campaign just really resonated with what we call the rise of the South Asian progressives. They're often younger. They're often, they care about Medicare for all. They care about eliminating student debt. And he managed to really draw a huge support base from this community. And you could also see that from the Queen's rally he hosted. He had, rapper Anik Khan, who's Bangladeshi American. He tapped into Chaya, which is a Bangladeshi advocacy network and nonprofit. So Sanders really was able to kind of rally a lot of these younger South Asians who really believed in a lot of his vision and a lot of what he stood for. And if you look at the numbers and how he was polling, even in 2016, when you see the numbers, you can see that he specifically had resonance amongst like Pakistani Americans and Bangladeshi Americans, whose parents in 2016 had a smaller rate of incidence of voting for Clinton. So Clinton was much more popular among Indian Americans, for example, and a little bit less popular among Pakistani Americans and Bangladeshi Americans. And Bernie was more popular among them. So you can kind of already start seeing these differences within nationalities, which again are still not the best, psychographic to really explain what's happening in trends, but is one metric. So Bernie Sanders going out, he represented a lot to a lot of South Asian Americans. It also helped that his campaign manager was Pakistani American Faiz Shakir. We also interviewed him for The Juggernaut and talked about how he has also influenced Bernie's campaign. When you see somebody who looks like you running a national campaign for one of the leaders of the Democratic candidacy, it changed the entire conversation. 2020, more than any other year, had many South Asian Americans leading national campaigns, from Kamala Harris's campaign manager, Rohini Kosoglu, to Cory Booker, Sabrina Singh, who then went on to work with Bloomberg. So in terms of the way we think about the news, highly suggest you check out our story on Bernie Sanders and the rise of the progressives, as well as our interview with Faiz Shakir, to really understand what's happening.
It is, Visha, we have Padma Shri Dr. Sudhir Parikh in the special edition of this week with him. And he recently participated in the Global Indian Physicians COVID-19 Collaborative, which was launched by Global Association of Physicians of Indian Origin, American Association of Physicians of Indian Origin, British Association of Physicians of Indian Origin, the Canadian Indian Network Society, and Canadian Association of Physicians of Indian Origin. Dr. Sudhir Parikh shared some of the main features from this conference, as well as here is a conversation about overall impact of this corona virus generated crisis on our lives. Namaskar, I'm Ashok Vyas, and I welcome you to this special edition of This Week with Padma Shri Dr. Sudhir Parikh. Doctor, welcome.
Thank
The
you.
the
Thank you
world
very much. Namaskar.
the world has changed, Dr. Saab, with corona virus having affected our normal life pattern. How have you taken this new normal, which is staying home by everybody, and life seems to be standstill?
Well, I mean, this coronavirus is a very serious crisis, uh, and the whole life has changed drastically for everyone. It affects everyone, whether it's a child, adult, professional, non-professional, everyone. And now this lockdown to prevent spread of the virus, because this is the only thing which we can do to prevent the spread of the virus, as we know that this virus transmit by droplets, and the droplets transmit go up to 4, 5, 6 feet, not beyond that. So as long as you maintain that social distance, uh, chances of you catching the virus from the person who is infected is much less. This virus has made everyone's life different. Most of the people are working, I mean, all the people are working from the home. Those who cannot work from the home, they are just spending their quality time with their families. But again, all this lockdown has tremendous effect. And as I understand from Governor Cuomo and President Trump, from yesterday's press conference, that in New York, New Jersey, which is epicenter of this pandemic, the number of cases to ICU are getting less, number of admission to the ICU is less, and number of discharge is more. That's a good silver lining in this horrific situation. But that does not mean that we should put our guards down, because this disease is still there. It is community it transmits through the community context. So we have to keep our social distance. We have to keep washing our hand with the soap and water 10 times a day. Try not to touch any barren open surfaces, or don't touch your face, eyes, or nose, because that's a real entry of the virus into the body. And this virus is, it starts with the small flu-like symptoms. 90% of the patients, those who start these symptoms, they get better, and it resolves by itself without much real specific medication. But 10% gets more seriously sick. They get breathless. They get breathless. They cannot breathe properly. Oxygen level drops, and these patients needs hospitalization. And out of that, at least 2 to 4% of the patient succumb to the death, because here the lung collapses very fast, and even ventilator or any other help doesn't save them, because of the lack of the specific treatment for this disease.
So now, the way things are, many times you feel that we are in a sort of a helpless zone, because nobody seems to have a clear idea as to how to get to the point of sure cure. And you have recently been a part of a global conference call of all the physicians. Is there any new insight that you may want to share from that interaction?
Yes, our global conference this morning where uh, eminent doctors from the USA, from England, Australia, and India took part in that exchange of the ideas about this coronavirus. So we discussed a potential specific treatment for this virus, which is very important because once we have a treatment, then we can control this virus easily, and in society the fear factor goes down. And currently they are working on certain in New York City in the hospital with those sick patients who are suffering from the this virus. They are working on a specific trial. One is a chloroquine with the antiviral drug and zithromycin. Then second one is an antibody injection, that is a plasma therapy. Third one is another antibody injection called interleukin. And also they are working on some other method of treatment. But all those treatment are in trial, on the trial phase. And right now they are kind of trying on the admitted sick patient, so that way we'll know the results in very relatively short time, and we'll see, and hopefully we will develop the specific treatment for this virus down the road. But the most important thing is vaccine, and unfortunately vaccine is about 12 to 18 months away. Once vaccine comes, then I think we'll conquer this virus for next season or subsequent seasons, because all these viral infections, they keep coming back in the fall and winter.
Doctor, you mentioned about plasma therapy antibody. What is that? Can you explain a little bit?
Yes, those patients who got infected, I mean, I'm sure there is almost 30-40%, 20-30% of the patients are already infected. And if after 2 weeks of infection, once infection is gone, acute infection is gone, it takes another 2 weeks to develop the antibody in the blood. It's called antibody called IgM, IgG antibody against this specific viral protein. And so if you draw the blood from those patients, those who had this COVID positive patients, then you will see that the serum and plasma, which is a part of the serum, has these antibodies. And once you inject these antibodies to any acutely ill patient, they do recover, because that's a kind of antidote to the viral infection.
Thank you, Doctor. And now talking about the relationship between India and America, especially in current circumstances, President Trump mentioned about Prime Minister Narendra Modi having a couple of times conversation with him, and the recent, should we say, collaborative efforts of India and USA against this war, as is termed by President Trump, against the invisible enemy.
Yes, actually India and USA, they are working together in coordination and cooperation. India is a country where chloroquine, hydroxychloroquine is produced in large quantity by pharmaceutical company. And government of India is ready to help USA, and they are going I think they are already sanctioned export of the medication, particularly hydroxychloroquine, to USA, and that will be useful for this clinical trial and subsequently for the treatment.
And there is so much that we want to learn from you, but today you are not just a physician, you are also an entrepreneur, and you have always looked at life with a sense of hope and optimism. The kind of situation that business owners are facing these days, and overall there is a sense of gloomy clouds hovering around people because they don't know how once it gets over things would be. So your take in terms of mental approach and attitude.
Well, obviously, this kind of crisis does affect the economy, and particularly the small business economy, even in the large business economy, because once you have shut down, means there is no activities, no consumer, no one is spending anything, or no one going anywhere. So economy is bound to affect. But hopefully, with the government stimulus plan, which is $5 to $6 trillion stimulus plan, as well as reducing the interest rate and boosting the economy. Hopefully, once whole society lockdown is opens up or lockdown is will end, I think slowly economy will bounce back. Of course, certain businesses will take a little longer time than other businesses, but eventually, if government with the government help, I'm sure, and as you know, the America is entrepreneurial country, and people are very entrepreneurial. So definitely, it will bounce back in next 3 to 6 months.
And as we move towards the concluding part of this program, your final words for our viewers.
Well, I mean, friends, this is a very serious disease. You must take very seriously. Do not let down your guards. Keep the social distance and keep washing the hands and keep the other personal hygiene. That way, you can avoid this horrible, dangerous virus or enemy, whatever you call it. And so, stay home, stay safe, be healthy. Jai Hind. God bless America. God bless India.